Hello, my name is Japneet Gill. I work as a neonatal intensive care unit NICU nurse, and pretty much I care for neonates as my patients and their families and caregivers, and I serve as an advocate for a vulnerable population. And oftentimes, neonates will stay in the NICU for a prolonged period of time due to complex disease processes such as prematurity, infections, genetic disorders, congenital heart problems, and respiratory issues. And during their NICU stay, they will be exposed to a variety of situations such as central lines, catheters, intravenous solutions that they're getting, as well as multiple nurses and visitors visiting the NICU. So during their NICU stay, there's a wide range of providers and healthcare workers that are involved in their plan of care, such as respiratory therapists, neonatologists, nurse practitioners, as well as speech language pathologists, and all of these interdisciplinary team members work together to provide the best quality of care. However, not everybody is knowledgeable in central line practice. Oftentimes, the NICU nurse is providing the majority of care since they are the bedside nurse, and then their assessments, vitals, and interventions are then communicated to providers. And because of this, a lot of times these nurses are not knowledgeable regarding how to insert, handle, and maintain central lines. Although there are some nurses on the NICU floor that are certified to insert PICC lines and other central lines, not every bedside nurse is equipped with that knowledge. And oftentimes, NICUs are accounting for 38% of infections in ICUs, so that's a pretty large percentage for a NICU stay. And some of the ways that we can help lower the healthcare associated infections, otherwise known as highs in NICUs, are by providing training and knowledge to bedside nurses regarding the central line care bundle, which typically consists of how to maintain the central line and preventing any infection from occurring. So, for example, cleaning the hub of the catheter with an alcohol-based rub, or using Curos caps to prevent any infection. So some of the ways the department can do this is by having semi-annual trainings, which can be provided by the nurse educator. Additionally, having infection control kind of give their research and knowledge base to bedside nurses can really help lower the rate of healthcare associated infections. In addition to that, research has shown that unsafe nurse-patient ratios actually causes increased healthcare associated infection rates because nurses may not be practicing adequate hand hygiene, or simply because they become task oriented rather than following hygienic practices. So another thing that the department can do is, I know we are in the COVID-19 pandemic, which we have lost a lot of bedside nurses too, but maintaining safe nurse-patient ratios will result in decreased healthcare associated infections such as CLABSIs, CAUTIs, ventilator associated pneumonia. And so this can be implemented by having travel nurses come in and help out different departments to ensure that we are having adequate nurse-patient ratios. In result, this will lead to better patient satisfaction, reduced readmissions to the department, and lower healthcare costs related to prolonged hospital stays, which is oftentimes what happens with these healthcare associated infections. Patients are staying longer, so their medical bills are increasing, and in result, the hospital doesn't have enough beds for other critical patients because they're treating these patients that um, have gotten an infection from their prolonged hospital stay. So these are just some ways that we can help lower healthcare associated infections. I hope you take them into consideration. Thank you.